Today in this lecture, we will talk about creatinine clearance and the use of plasma creatinine concentration to estimate GFR or glomerular filtration rate. So we will learn about creatinine clearance and the use of plasma creatinine concentration to estimate glomerular filtration rate. To properly understand this creatinine clearance concept, we need to quickly revise the concept of renal clearance, which we discussed in detail in our last lecture. In renal clearance, we discussed in detail that renal clearance is the effectiveness of the kidneys. Renal clearance simply means that how effective are the kidneys in removing some waste from the plasma. And the kidneys basically are made of nephron, the functioning nephrons. So if the kidney is effective, it means the nephrons are functional and they are not defective. Now, renal clearance simply means the cleaning of plasma from waste material. So if the kidneys are in very good condition, a very small amount of plasma will be needed to remove some waste material. And now this volume of plasma need to pass through the nephrons to remove this 1 milligram of waste. If the kidneys are very effective, the renal clearance is normal, very good. Now, if the kidneys get damaged, the renal clearance decreases and the kidneys are not able to remove this 1 milligram for this small amount of plasma. Rather, the kidneys will need this much big amount of plasma volume to pass through the glomeruli so that it can remove the same amount of waste. For the same 1 milligram of waste, the kidneys now need double or triple the amount of volume to pass through the kidneys because the renal clearance is decreased. And clearance means the effectiveness, the working conditions of the kidneys is decreased. The working condition of nephrons has decreased due to some diseases or conditions. Now, if the kidneys function decreases further, the renal clearance decreases further, the kidneys functions deteriorate further. Now the same 1 milligram of waste will be removed from this much big amount of volume of plasma. So the same waste which initially could be removed from this much small volume of plasma, 1 ml of plasma, is now being removed from this much big, 10 times bigger volume of plasma. Now this much big volume of plasma need to pass through these nephrons, and kidneys will be able to remove only 1 milligram of waste. So it shows the deteriorating function of the kidneys and the decreasing renal clearance. Now, how to calculate the renal clearance? Renal clearance is calculated by this simple equation in which this C stands for clearance of any substance into the plasma concentration of that substance, which is equal to urine concentration of that substance into the volume of urine formed. Now this is the equation. Clearance of a substance into plasma concentration of a substance must be equal to urine concentration of a substance and volume of urine formed. Now this part of the equation forms the filtration load. This part of the equation shows the filtration load, the amount of filtered substance here, and this part of the equation shows the amount of substance which is removed, the amount of substance which is removed. By readjusting this equation, we get the clearance of any substance. So to calculate the clearance of any substance, we need to use this equation in which we need the following data. We need to calculate the concentration of that substance in the urine. We need to calculate the volume of urine formed in a specific amount of time, especially 1 minute, for example, and we also need to calculate the concentration of that substance in the plasma. So if we have these three values, we can calculate clearance of any substance which is present in the plasma. This is one thing. This is the renal clearance concept. But if we have a substance which get filtered here and it neither gets reabsorbed into the tubule and neither it gets reabsorbed nor it gets excreted into the tubule, then such a substance has the clearance equal to the GFR. Such a substance has the clearance equal to the GFR. And one such substance is inulin. So the inulin is filtered here. It is neither reabsorbed and nor secreted into the tubule. So its clearance is equal to the GFR, and its clearance can show you how effective is the glomerular filtration rate, or if there is any decrease in the glomerular filtration rate, or if there is any increase in the glomerular filtration rate. For such substances, the clearance is equal to GFR. Now this is one substance, inulin, which can be used in experiments, but we in normal routine do not use inulin. We use another substance which is known as creatinine. Now creatinine is secreted, is formed from the metabolism of proteins in the muscles especially, and it also is filtered here, and it is excreted in the same volume or the same amount. Only a very negligible amount of it is secreted. It is a small amount or negligible amount of creatinine is excreted into the tubule, but also there is a small error in the calculation of plasma concentration of creatinine. So creatinine is a very good thing to be used to calculate the GFR. And the topic today was how to use the plasma creatinine concentration to calculate a GFR. So if we simply know the plasma creatinine concentration, we can roughly calculate the GFR, because the plasma concentration of creatinine is inversely proportional to GFR. If GFR increases, plasma concentration of creatinine will decrease. If the GFR decreases, the plasma concentration of creatinine will increase. Sometimes we do not even need to measure these two values, the concentration of creatinine in urine and the amount of urine, the volume of urine, and we can simply roughly get an idea of about the GFR, the functioning of the kidneys, by simply measuring the creatinine. So it makes the creatinine a very good substance to measure the clearance of the kidneys, to measure the effectiveness of the kidneys, to measure the working conditions of the kidneys. Now, with the help of these graphs, we can now see that for the creatinine concentration, it is almost equal to the GFR, because we discussed that creatinine is just like inulin. It is filtered here. There is negligible secretion. There is negligible secretion and negligible error in its calculation, which balance each other. So the filtration is almost equal to the excretion in urine. So creatinine clearance is equal to the GFR. Now here we have mentioned this thing, that the creatinine clearance is equal to GFR, and this creatinine clearance or the GFR both can be calculated with this equation. If we have the urine concentration of creatinine, if we have the volume of urine in 1 minute or a set amount of time, and if we have the plasma concentration of creatinine, then we can easily calculate the GFR. And that's the topic for our discussion today, that how the plasma creatinine concentration can help in the calculation of GFR. Now, we got this equation from the same equation which we have discussed in detail, and this equation has two components. One is the filtration load. The filtration load here is equal to a concentration of a substance, a clearance of a substance into plasma concentration of a substance. Plasma concentration of a substance into clearance of a substance is equal to the filtration load, which must be equal to the excretion, which is the product of volume of urine and the concentration of that substance in urine. Now, with this, from the same equation, we got this equation. This equation, but we discussed that for creatinine, its clearance is almost equal to GFR. Now, this thing can be explained with the help of this graph, and these graphs show that whenever the kidney functions decreases, whenever the renal clearance decreases, whenever there is some disease and the GFR decreases, for example, the GFR was here, it was 100 and it has decreased to 50, to this level. It has decreased to this level. This decrease in GFR, it will increase serum creatinine concentration. It will lead to increasing concentration of the serum creatinine. Now, this graph shows the creatinine production and renal excretion. Creatinine production and renal excretion. And this graph shows that the production of creatinine in the body, it remains the same. This is a straight line. The excretion part is a dotted line. So these are two different lines. One is the dotted line, other is a straight line. The straight line shows the production, the dotted line shows the excretion. The excretion should be equal to the creatinine excretion should be equal to the creatinine production. But when there is a decrease in the GFR, the excretion, the renal excretion of creatinine, it decreases, because the filtration load of creatinine is a product of plasma concentration into the glomerular filtration rate. So if the GFR has decreased, but the plasma creatinine concentration remain the same, then this excretion and this filtration load decreases. Filtration load is the amount of creatinine that is filtered here. So if the glomerular filtration rate has decreased, then the filtration load will decrease. And when the filtration load decreases, it ultimately leads to decrease in creatinine excretion as well. But we know we need the removal of creatinine from the body. How the kidneys will compensate this? Over a period of time, creatinine concentration in the plasma will start increasing. And a positive balance will occur. What is a positive balance? It is simply the accumulation of extra creatinine in the body. The amount of creatinine in the plasma will keep on increasing until and unless the excretion of creatinine becomes equal to production. Now, this is a simple concept. When the GFR decreases, when the glomerular functions decreases, creatinine is not being filtered in the kidneys, so it starts accumulating in the blood. Its level starts increasing in the blood, but the production remains the same. See, the production is a straight line, but the excretion decreases. Excretion decreases due to decrease in GFR. So to bring the excretion equal to the production, the positive balance occur. The positive balance is the accumulation. The body start accumulating creatinine, and the level of creatinine in the body keeps on increasing until and unless the excretion becomes equal to the production, but at a higher level of plasma creatinine. Now, if this graph has equalized, if this excretion graph has equalized the production level, now here the excretion is again equal to the production, but this thing occurs at this level of plasma creatinine, at a higher level of plasma creatinine. This can be also shown with this graph. When the glomerular filtration decreases from 150 towards this 25 level, you see the plasma creatinine concentration keeps on increasing. When the GFR keeps on decreasing due to some diseases, the plasma creatinine concentration keeps on increasing. But this increasing concentration of creatinine makes sure that extra creatinine is removed from the body, and ultimately in a steady state the excretion equalizes the production, but at the expense of a higher level of plasma creatinine concentration. So that's the concept of the creatinine clearance and the concept of GFR, and it is very simple. Normally we need to have two equal parts of this equation: the filtration load versus the excretion, and this excretion must be equal to the filtration load. Excretion here is, see, it is a combination of, it is a product of urine concentration into the urine volume, and filtration load is the product of plasma creatinine concentration into the GFR, and these two must be equal, This is excretion, and this excretion must be equal to the filtration load, and whenever there is defect in one of these, the other value compensates, but it makes sure that excretion is equal to production. But it will occur at a higher level of blood creatinine. These compensation will also be up to a specific limit, after which plasma dialysis may be needed or some other therapy may be needed. So that's all about the creatinine clearance and the use of plasma creatinine concentration to estimate the GFR, and also that's a simple topic about the relation of GFR with the plasma creatinine concentration and relevance of creatinine production versus creatinine excretion. Thanks a lot for watching the video.